Colorectal cancer is a cancer that arises in your colon or your rectum, so part of your large intestine. So colorectal cancer often is present without causing any symptoms, which is why it's really important to get screened at the appropriate age. The recommendation now is to start screening at age 45, but you may need to be screened even earlier if you have a family history of colon cancer or polyps in the family or other genetic predispositions. So it's really important to talk to your doctor about when you should get screened, but the latest should be age 45. There are many different methods of screening for colorectal cancer, but the number one best method is still a colonoscopy. This involves getting sedated and then having a very flexible skinny tube inserted into the rectum and looking through the entire colon, looking for things like polyps, which are precancerous lesions that can be removed so they don't have a chance to grow into cancer. Once someone is diagnosed with colorectal cancer, it's important to determine the stage. So the size of the tumor will determine part of this, but also whether it's spread beyond the colon to other organs. Often surgery is necessary to remove the primary tumor, and then the treatment may involve things like chemotherapy or radiation, depending on the stage and the location of the tumor. We know that there are certain risk factors for colon cancer that you can control, unlike things like family history. So we know that if you're a smoker, if you're an excessive drinker, if you have a sedentary lifestyle, if you have more meat, particularly processed meats as opposed to fruits and vegetables, these are all things that can increase your risk of colon cancer. So maintaining an active, healthy lifestyle, maintaining a healthy weight, making sure you have a diet full of fruits and vegetables predominantly, these are all things that can really lower your risk of colon cancer. Although colorectal cancer is more often diagnosed in people over the age of 50, we are actually seeing an increase in diagnosis and death from colorectal cancer in younger people. In fact, for men under the age of 50, it's the number one leading cause of cancer death. So it's really important, no matter what age you are, to talk to your doctor about the appropriate screening age. And certainly we are seeing more and more cancers in men in their 40s. I think it's really important to understand that colorectal cancer is very treatable when caught early. In fact, the 5-year survival for the stage 1 is over 95%, which means don't be afraid to get that colonoscopy and potentially get the diagnosis, because if caught early, you have a very good chance of getting the right treatment and surviving very well.